The coronavirus pandemic is showing no signs of slowing down, with global deaths expected to hit 2 million today. Even as countries race to vaccinate their populations, the COVID-19 death toll continues to rise at an alarming rate. New strains of the coronavirus, which scientists believe are more transmissible, have been blamed for the surge in infections. Across the world, countries are facing a second or even third wave of infections, with many governments tightening even further the lockdowns already in place. One country that's been plunged into crisis by a new strain of the coronavirus is the United Kingdom. There, the number of cases and deaths has been skyrocketing since December. Many hospitals are overwhelmed with COVID patients and, as a result, are no longer able to carry out other operations. As DW's Charlotte Chelson-Pill reports, this is taking a huge toll mentally and physically, both on the population and the medical workers trying to save lives.
I've never seen so many ambulances queuing, and I've never spent such extended periods of time with people waiting for a space.
Over the last 3-4 weeks, the majority of patients are now coronavirus.
And take a nice deep breath.
Every region in England has more people in hospital now than they did in the first wave in the spring.
In our case, we've gone up by double the number of patients.
We're still in London admitting the equivalent of a really big hospital every single day.
Whilst having higher numbers of staff and frontline staff who are off sick or isolating or have tested positive themselves. I've just finished 10 days of isolation because my wife tested positive, so she's also a paramedic. The personal protective equipment that we were wearing was, from our perspective, not quite enough, and a number of our friends and colleagues were in the same situation, and they've also tested positive over the last few weeks.
I think the impact of the new variant has been immense.
It is just more infectious, 50% more infectious.
Where we were at the beginning of December thinking we had weathered the storm, suddenly we've had a surge in numbers so huge we couldn't have imagined it would be as bad. And that's because this new variant spreads so easily, spreads like wildfire, and it's caught us a lot by surprise.
The new variant just made it absolutely explode. And again, we waited too long to stamp down on it.
There's still more to come from this wave of the pandemic.
Well, we expect the mortality will go up.
And we're seeing far more people being admitted to intensive care units that are now becoming overwhelmed.
A lot of hospitals in the southeast are now cancelling what are called 28-day cancer surgeries. The people who've had their surgeries cancelled are now having to wait at home knowing that their tumour's growing. And for some of them, by the time it's safe again, they might not be operable anymore, and that they've lost that window. So I mean, that to me is a kind of a mental torture.
I know a lot of people that find it very tough.
One of my friends said, he was just helping a colleague having a panic attack the other day, that people are having nightmares about it.
The really hard thing about being stuck at hospital for 5 hours is that all the time that you're there, you're hearing your colleagues in the control room asking for ambulances to be available to go to other emergencies and to people that need your help, and you can't go.
They're constantly in a situation where they know they're not doing the best for their patients, or they're trying their best, but they're just not in a position to be able to do that.
And that's something that people are wrestling with quite a lot, is knowing that they might have been able to do some more, or if they had have arrived earlier, then they might have been able to change the outcome for a particular patient. I'm
sure it's having a toll up and down the country, but I don't think we have a choice. We just do our best and carry on. That's what we're trained to do. And I'm very privileged to work with people who feel that way.
It's hard, and it's taken its toll, but we know that we're doing the best we can in the circumstances. And if we didn't go out, then more people would die and would suffer as a result of not having people working on the front line.
Well, meanwhile, Germany has passed the 2 million mark in recorded coronavirus cases. It comes as Chancellor Angela Merkel pushes for a stricter lockdown. Merkel has told top officials from her party that she wants quick action to stop the spread of worrying new coronavirus variants. Well, in other developments in the pandemic, France is to impose a nationwide 6 p.m. curfew starting on Saturday. From next week, everyone travelling to France from outside the European Union will have to show a negative test and then isolate for 7 days. The UK has banned travellers from South America and Portugal over concerns about a virus variant that has emerged in Brazil. It comes as Brazil's health minister says hospitals in the Amazonian city of Manaus are running out of oxygen to treat COVID-19 patients.